Welcome to our discussion on strengthening human rights to respond to pandemic threats. This panel seeks to support human rights engagement by you, global health practitioners, researchers, and policymakers, supporting you in addressing interconnected issues of law, politics, and governance in global health. Good morning, good afternoon, good evening. My name is Benjamin Meyer. I'm a professor of global health policy at the University of North Carolina at Chapel Hill and the past chair of the Global Health Law Consortium. On behalf of our co-sponsors, the Global Health Law Consortium, the International Commission of Jurists, and the University of Essex Human Rights Center, I'm honored to welcome you to this discussion of the human rights impact of the COVID-19 pandemic and the need in the World Health Assembly to strengthen human rights in global health governance. We'll be discussing human rights under international law as a basis for global health, arising out of the human rights analysis that was developed for the independent panel on pandemic preparedness and response for the IPPPR. This panel discussion will address debates in the World Health Assembly on the future of human rights in global health. By bringing together human rights experts throughout the world who have advised the IPPPR, this panel will seek to support reforms in the World Health Assembly to strengthen global health and human rights. In outlining the background for this panel, with human rights law serving as a central framework in the COVID-19 response, we recognize today that human rights stand as a central normative framework for global health, offering universal legal standards by which to frame government responsibilities and facilitate international accountability. States have worked through the United Nations for over 70 years to develop health-related human rights under international law, establishing through international human rights law a legal foundation to frame infectious disease prevention, detection, and response. In implementing these rights, the World Health Organization has championed the right to health in the COVID-19 response, but it's faced limitations in operationalizing its human rights authorities, global health policies, and human rights partnerships to mainstream human rights in global health. To mainstream human rights in global health in the pandemic response, in building back better, and in preparing for future public health emergencies. Reflecting on the human rights recommendations of the IPPPR, this discussion will focus on the importance of human rights to global health governance, with brief presentations by our panelists to open the discussion. We begin with Judith Bueno de Mesquita, the co-deputy director of the Human Rights Center and a lecturer in international human rights law at the University of Essex, who will discuss the human rights impacts of the COVID-19 pandemic as framed in her background analysis for the IPPPR. From there, Timothy Fish, who leads work on economic, social, and cultural rights at the International Commission of Jurists, will discuss human rights standards for health and the need to harmonize international human rights law and global health law. Advancing these ideas in global health governance, I'll then come in briefly to speak about the need for mainstreaming human rights in the World Health Organization. And then we'll finish our opening presentations with Sharifa Sekalala, an associate professor in the law school at the University of Warwick, who will discuss the implementation of human rights in global health law through revisions of the international health regulations and a proposed pandemic treaty. Based upon these opening remarks, and hoping that you will raise questions in the Q&A function in Zoom, I'll then turn it over to your questions, asking our panelists to answer these questions, to clarify the importance of human rights in global health, to discuss the human rights implications of COVID-19, to think about the prospects this week in the World Health Assembly for strengthening global health law and governance to face future pandemic threats through human rights. Please join me now in welcoming Professor Bueno de Mesquita, who will speak about the cataclysmic human rights impacts that we've seen over this past year. Jude, over to you.
Okay, I'm unmuted. Thank you so much, Ben, for your warm introduction, and welcome everybody to our panel event today. I'm delighted you've joined us, and it's my pleasure to join you from Essex University in the UK. And as Ben highlighted, my presentation in the next 8 minutes, very briefly, is going to focus on the human rights impacts of the COVID-19 response. And my presentation is going to focus on a paper which Ben and I, together with my colleague at Essex University, Professor Anuj Kapila-Shrami, developed for the independent panel on pandemic preparedness and response. And you can see our paper on the top left of the screen. I'll put a link in the chat afterwards. And that was to inform the work of the independent panel, which was convened in response to a WHO resolution last year to provide guidance on assessing the response to COVID-19 and recommendations to the international community. So I'm going to focus on 3 things in my presentation. Firstly, how human rights has been called for by UN leaders across different UN agencies to be at the heart of COVID-19 responses. I'm then going to draw on our paper to highlight some of the shortcomings in terms of how, in fact, responses have been problematic from the human rights point of view. And very briefly, I'm going to think about how human rights are reflected in global health responses, focusing particularly on the IPPPR's report. So I could mention a whole range of different UN leaders who've emphasised the importance of having human rights at the heart of the COVID-19 response. But I'm just going to refer here, in fact, to the resolution from the World Health Assembly last year on the COVID-19 response, in which it called explicitly on states also to ensure that in their national action plans that they ensure respect for human rights and fundamental freedoms. Now, there's been a huge amount of guidance which has been developed by the UN to support states to mainstream human rights in their responses, and that's not just their national responses, but also their international responses, working together through the international community. And I can't go into that in any depth in 8 minutes, but I just got here an image of the website of the UN High Commissioner for Human Rights, which is a really useful jumping off point to find all this guidance. And there's literally hundreds of bits of guidance that have been issued through statements, reports, press releases and guidance on different elements of human rights in the COVID-19 response. But unfortunately, the reality has been a far cry from these calls and this guidance. And a couple of months ago, UN Secretary General Antonio Guterres decried a pandemic of human rights abuses in the COVID-19 response. So in our report that we produced for the IPPPR, we set out what some of these international human rights standards are that states should be respecting, protecting and fulfilling in their responses. But what we set out to do first and foremost is to provide an overview of some of the different human rights abuses that have occurred in the COVID-19 responses. And to produce the report, we reviewed hundreds of documents, particularly documents from human rights bodies, and that's both UN human rights bodies and civil society organisations, which in order to help us build up a picture of the human rights impacts. And we located impacts in 4 main areas. The first of which is impacts on the right to health, and the sheer scale of mortality and morbidity from COVID-19 and the distribution of those illnesses and deaths, which are not equal, they themselves are perhaps the best testimony to the really shocking picture for the right to health in COVID-19. Also, if you think about the right to health, it actually includes entitlements to available, accessible, acceptable and good quality healthcare services and equipment. Yet we know also that vaccines, treatment and health information have been sorely missing for many people in the COVID-19 response, as states have not upheld their right to health obligations. Further, right to health requires public health measures to protect vulnerable and marginalised groups. But the predominant picture has been one of inequalities with populations, whether older people, people deprived of their liberty, persons with disabilities, ethnic and racial minorities, refugees, LGBTI persons, and so on and so forth, suffering predominantly in terms of their human rights in the COVID-19 responses. Now, moving beyond health, there's also other economic, social and cultural rights, which underlie the right to health as well. So the right to education, the right to housing, the right to water and sanitation, and the right to food. And in taking measures to protect health, public health in the COVID-19 responses without economic and social protection measures to support these other rights, these rights have also been very much at risk. Thirdly, there's civil and political rights. And while international human rights law includes some flexibilities to allow states to restrict certain civil and political rights to protect public health, there's quite constrained circumstances when that's permissible, but they are there. What we found that is, in fact, many state responses have exceeded what is considered to be permissible limitations, amounting to killings, mass detentions in unsafe facilities, restrictions on the press, clampdowns on political opponents, and so on and so forth. We also highlight the importance of rights-based governance, so participation, allowing communities to participate in decisions concerning their health, which can of course lead to more effective health policies, as well as being rights-respecting. Other governance considerations as well, such as transparency and accountability, which have also been sorely lacking. And finally, international assistance and cooperation. And while that covers a range of issues, clearly at the present time, it's particularly concerned in relation to vaccine inequalities worldwide, which human rights bodies have labelled as discriminatory. So moving on from these human rights concerns, we also, I wanted to highlight that different public health agencies internationally have issued a huge amount of really valuable guidance to states for addressing COVID-19. The World Health Organization has led these efforts, but its own guidance it does take into account human rights, but in my view, the organisation should be doing more to do so, more in this area, and Ben's going to talk about that in a few minutes. It can be done. Other agencies, most notably UNAIDS, has done a really important job drawing on their experience of rights-based approaches to HIV/AIDS. They've done a really impressive job of highlighting how rights-based approaches can support public health responses in the pandemic. And I just want to close with a few remarks about the IPPPR's own report. So this is the report which Ben and I and Anuj prepared a background paper for. It was a little bit disappointing for us, because even after all our efforts to prepare the report, this report itself is fairly extremely limited when it comes to integrating human rights. In fact, it barely pays lip service to human rights. And in the words of one of my, a dear former colleague of mine, he said, "Are human rights just for a background paper? Are they just a background concern?" And what we had argued is that human rights shortcomings underlie the outbreak, underlie its spread, its treatment shortcomings and efforts to control the COVID-19. But the IPPPR report does not highlight these human rights dimensions, with the report focusing more on reporting technical and governance shortcomings rather than issues to do with inequalities, injustices and failures to realise human rights obligations to civil, political, economic, social and cultural rights. The report declines to raise and make recommendations on specific human rights issues that have arisen in COVID-19 and how human rights contribute. Instead, it addresses issues that are human rights issues, but in technical language, which undermines the understanding of these issues as human rights issues. Just to give a couple of examples, one of the concerns of the report is that there's been a lack of planning and gaps in social protection, which have resulted in the pandemic widening inequalities with a disproportionate social and economic impact on women and vulnerable and marginalized populations, including migrants and workers in the informal sector. This is of course true, but this framing does not suggest what the situation is in reality, which is an affront to women's rights, the rights of migrants and rights of persons in marginalized situations. Equally, if you look at recommendations on vaccines, there's many important technical recommendations in there related to TRIPS and COVAX and so on and so forth, but it doesn't present this as a human rights obligation on states. It just frames it in terms of what states should do for public health measures. Okay, I'm going to stop there and I'm going to hand over now to Tim. Thank you.
Hi, everyone. Good evening from where I am and good morning some other places. My name is Tim Fish-Hodgson. I am a legal advisor on economic and social rights at the International Commission of Jurists, based here in Johannesburg, but operating around the world. I think I'm just going to start off where Judith left off and state it as clearly as I possibly can. The IPPPR report, the absence of human rights in it is a big failing, and it seriously limits the ability of the reports to actually guide states appropriately, and the WHO in its way forward in ensuring that the pandemic is responded to in a human rights compliant manner, for the reasons that Judith has already expressed, but because also the fact that human rights language is not used means that people's human rights that have been violated, the actual violations of human rights, cannot be acknowledged, even though they are so patent and so clear across the world, as Judith also mentions. Another important point of it is that one of the reasons for the violations of human rights is that states, even though they are bound to human rights standards, have not often seen fit to consider and comply with those human rights standards, often claiming disasters or emergencies as the reason for this. But if influential reports and panels like this that will have a big effect on the global health governance and global health infrastructure don't even consider human rights and don't use human rights language, how can they, the panelists and the reports and the global institutions, expect states to do so? This is obviously going to be a very important thing in the center of what I'm speaking about. The report itself says, and I'm quoting here, the language of health statistics and economics cannot convey the depth of disruption as COVID-19 has overturned people's lives. And this is quite right. Although the panel itself notes that its recommendations are sometimes ambitious and calls on political decision makers at every level to champion major change and make available the resources to make it effective, it doesn't use the language which would require those resources to be allocated in an equitable way to ensure the realization of economic and social rights and protections, including the realization of the right to health being deprived of people all around the world for a number of reasons at the moment, most significantly in the public eye, including access to vaccines. So this is not a small omission, and it's not a question of nomenclature. It's a question of how the panel has seen its power and how the panel sees states' power at this time. And if we have lost even the ability to call on human rights standards to hold states to account, the question is what we really do have. A similar thing could be said about the International Health Regulations Review Panel appointed by the WHO. The WHO is not an organization famous for taking into account human rights standards, and we'll hear more about this, and Ben will talk more to how this can be improved. But the IHR Review Panel, although drawing on human rights concepts like proportionality and aspects like this, doesn't really take into account properly either, like the IPPPR panel, the need for the IHR to be interpreted consistently with and in harmony with international human rights law standards, including on the right to health. The same is true of recommendations made by both the IHR Review Panel within the WHO and the IPPPR panel. on a UPR-like mechanism, a peer review mechanism to be set up within the WHO for compliance with global health standards, and the recommendation for a pandemic treaty. The question is, how are we to believe and how are we to know and be assured that human rights will be at the center of these conversations, these important conversations, if they are not at the center of and clearly comprehended and discussed in the IHR processes and in the IPPR panel? The ICJ itself is undergoing a process and participating with the Global Health Law Consortium in a process of trying to improve upon the way that the IHR regulations and the Syracuse Principles, the main principles that allow for the limitation in some circumstances of some rights for a public health emergency in the context of a public health emergency like this. And so the International Commission of Jurists and the Global Health Law Consortium have called for the harmonization of international human rights standards set out in the Syracuse Principles and the international health regulations. In brief, the Syracuse Principles, which are accepted now as internationally binding human rights law, require proportionality and evidence-based measures to be the only measures which limit and restrict rights in the name of emergency. To add to that, it's very important that those measures, when there's a public health emergency, are taken in the fulfillment of and are capable of realizing the right to health, because it's important to remember that in a public health emergency, that is the justifications for states to act to restrict our movement and to make the regulations that have governed our daily lives for the entire time. The Syracuse Principles need updating in the context of public health emergencies for some very clear reasons, and I won't name them all here, but a few of them are that when the Syracuse Principles were developed, they only dealt with restrictions on civil and political rights, so like movement and free expression and aspects like this. And we have seen those rights limited by states in their COVID-19 responses, but they have, the Syracuse Principles don't deal with economic and social rights, and we've seen limits on the rights to housing, social security, work, and economic devastation that's been caused by COVID, and this really needs to be considered in that context. They also don't focus sufficiently on access to justice, so measures that people will have in order to claim their rights if they are unduly restricted. And what we've seen almost all over the world is that there have been these restrictions on rights in the name of the right to health or in the name of public health, but there have been insufficient and inadequate mechanisms like access to courts as a result of the pandemic itself and other ways of accessing justice when you allege that your rights have been violated. In other circumstances, and another point that should be discussed, is what we can do in the international standards to signal to courts that they're supposed to have a role to intervene, because many courts have been of the view that they should defer in circumstances of emergency and disaster, and this has caused further violations and prevented one way of relief that is normally provided. So really at the center of all of this, from the ICJ's perspective, the right to health and the rule of law should be cemented and entrenched explicitly and in detail on the face of international health regulations and international human rights law. The two should be harmonized. They should be drawn together. We cannot have a system of binding WHO law and binding international human rights law that exist in completely separate entities, with governance structures in the WHO not paying attention to international human rights standards and international human rights entities not paying attention to global health law. And the final question that I'd like to leave you with is that myself and many others have been involved in conversations and attempting to think about ways that we can improve the implementation of human rights. Really, the question that we are left with often is, if human rights can be ignored so easily and interpreted so marginally to not make an impact in the context of something like this pandemic, should we not look to and consider, in addition to calling for the implementation of human rights, calling for the implementation of healthcare systems and human rights that are sufficiently progressive? And some use terms like decolonized or sufficiently restructured or structurally appropriate to effect significant change and protection in the context of pandemics. I'm going to leave in the comment section now a blog that me and several colleagues have written calling for feedback with an email address where you can give your feedback on how it is that we can harmonize global health law and international human rights law in an effort to ensure that in future circumstances like this, where we have a global pandemic, we have one coherent system of law and can contribute very significantly to the protection of human rights for everyone. Thank you. I think that we are now going to go to Ben.
Thank you so much, Tim and Jude. Shifting us now from state obligations to institutional responsibilities. I'll be speaking briefly about how human rights have increasingly come to be seen as a necessary responsibility of institutions of global health governance. With the right to health declared for the first time in the WHO Constitution, and WHO looking to implement the right to health in its policies, its programs, and its practices. While WHO long resisted its human rights responsibilities, as Tim said, WHO is not famous for taking human rights into account, often to its own detriment. The past 30 years have seen WHO take tentative steps to work to translate human rights law into global health governance, transitioning the UN system from the development of health-related human rights under international law to now thinking about the implementation of these normative standards in global health policies. And in accepting obligations of international law as a framework for global health governance, WHO has come to see itself as having responsibilities for human rights, both in the mission that it pursues and in the way that it carries out that mission. While WHO is certainly not a party to human rights treaties under international law, it's sought to understand how it can commit to health-related human rights. With these evolving institutional responsibilities, leading the World Health Assembly to become central to implementing human rights law in framing WHO's organizational policies, programs, and practices. Since the early years of the AIDS response, a response that revealed the need to promote human rights in order to prevent disease, WHO has sought to implement human rights, both in assisting states to implement human rights under international law through their own domestic policies, and in implementing human rights directly in its own institutional policies, programs, and practices. As WHO moved human rights beyond the exceptional AIDS response, encompassed a range of health-related human rights under international law, WHO has begun to consider a more systematic application of civil, political, economic, social, and cultural rights to its institutional mission, embracing human rights in a select but growing range of public health challenges, and in seeking to mainstream human rights throughout the organization, the Secretariat, the regional offices, and the country offices. WHO has sought to frame health as a human right in its work, employing this framework with mixed success to elevate rights-based approaches to WHO programs, to frame state responsibilities, to advance primary healthcare, and to support WHO's authority in an increasingly crowded global health landscape. As we think about this mainstreaming work across the WHO Secretariat, as the World Health Assembly moved to revise the international health regulations at the turn of the century, WHO incorporated human rights obligations as central to responding to public health emergencies, with the revised IHR in 2005 requiring that implementation shall, quote, be with the full respect for the dignity, human rights, and fundamental freedoms of persons. Obligations under the IHR that, as Jude discussed, have more often been seen in their violation. And yet WHO's high-level commitment to human rights has been seen prominently under Dr. Tedros's leadership in his advocacy for the right to health as a foundation for universal health coverage, in WHO's framework of cooperation with the Office of the UN High Commissioner for Human Rights, and in its robust defense of the right to health in the COVID-19 pandemic. This continued support for human rights and global health now demands not just support from the top, but capacity building efforts to mainstream human rights throughout WHO's governance, so that these high-level rhetorical commitments, whether by the Director General or whether in superficial pronouncements of the IPPPR, are translated into WHO governance, into individual health programs, and to the practices of WHO staff. And so mainstreaming human rights truly across the organization, at organizational level at the Secretariat, in the regional and country levels, will require technical guidance, will require staff training on rights-based approaches to health, will require spaces for civil society participation in organizational decision-making, as recommended in our background paper on human rights for the IPPPR, and in facilitating institutional accountability for the progressive realization of the right to health. The discussions this week in the World Health Assembly provide a pathway for WHO to support human rights accountability in the COVID-19 response. These steps this week will be critically important as WHO continues to take steps to mainstream human rights throughout its programming. As advocates seek to support human rights implementation in WHO programs and practices. And as Professor Sekalala will discuss now, in reshaping global health law in the World Health Assembly to ensure human rights in global health. Sharifa, over to you.
Thanks, Ben, for that wonderful presentation, and to all the speakers who came before me for really stating very clearly the insurmountable problems that we've had in not adequately dealing with human rights within this current crisis. And so going forward, we need to think, how do we take a human rights approach? So the first thing might be that we remain as we are, and we try to think about ways in which we might do human rights better. But I think as several speakers, so Jude and Ben and Tim have pointed out, this might prove insufficient due to the ways in which human rights were violated in this crisis, and the very real need both from really high-level government and from people below, that we need to go forward in a fundamentally different way. And the other two approaches around the international health regulations, which Tim talked about, and the new pandemic treaty, which both Ben and Jude have referred to. And it seems to me that although the IHR, as Ben rightly pointed to, mentions human rights and kind of broad descriptors of human rights, its many critics argue quite rightly that it didn't go far enough. And so any attempts to move us forward in terms of IHR revisions really need to think about concrete ways in which we can achieve human rights within that treaty body. That might be through, as Tim talked about, thinking about principles such as proportionality for public health crisis, and really making some of those obligations much more stringent. But it might also be going beyond general ideas around human rights. So the IHR very much demands human rights at all parts of the treaty, but it's not specific enough. And so we might want to think about that. In terms of the pandemic treaty, I think there we need to kind of think, what do we want? So if we have a blank slate as human rights lawyers, then it might be important for us to think what we want. So I share the frustration of those people who've worked in terms of trying to think about which human rights we could have. And I think that it's really important for me to kind of sketch out what kind of human rights provisions we could have in any amendments to any of these treaties. So I have 5 key points. The first point is that I think any amendment to any treaty in public health needs to have an explicit recognition of the right to health and not just frame human rights more generally. And this is largely because, as Jude referred to in her initial and really persuasive contribution, we see that there is this difference between civil and political rights and economic social rights, such as the right to health. And a framing that allows us to think about the rights to health more generally would really help us to think much more in depth around the things that we need to do in order to stem pandemics. So it will help us to think about preparedness, about prevention, about responses in a way that is human rights appropriate. And actually we have a huge swell of evidence, and you will find some of this in the report that Ben and Jude worked on, in terms of helping us to think about what a right to health approach demands. And this has been subsequent years of practice from special rapporteurs on the right to health, from UN treaty bodies. And I think using that normative inference of a right to health would only strengthen any provisions going forward. The second thing that we must have is that we must locate pandemic preparedness and responses in larger economic, social, and cultural rights frameworks. And this is really important because, as we have seen in the current crisis, lots of the issues that seem health related were also wider societal issues around housing, around social security, around employment. And if we really do not think about pandemic preparedness within that larger socioeconomic rights framework, then it's largely doomed to fail. My third major point here is around the proposals. So a lot of these proposals are focusing largely on the precautionary principle that we should take precautions, we should err on the side of caution the next time there is a crisis. But there is also a need, if we think about human rights much more carefully, to focus on proportionality. So as human rights lawyers, we're always used to pushing human rights first. But as people who deal with the right to health, we're also aware that in certain instances, you may need to limit people's rights. But I think we need to come up with better frameworks around to what extent, under what circumstances, for how long we limit those rights before the next crisis comes. Because as we saw in the current crisis, each nation did as it pleased, people took different measures, and we can't really have this development where different states do what they want if we really want uniform human rights standards. My fourth general principle is around the duty to assist. And I think we need to move beyond the charity model to a more obligation-based mechanism. So for instance, the current pandemic preparedness panel has thought of this global health council that would finance vaccines, for instance, and other public health goods. But I think that this normatively does not go far enough, because just because we have a new council does not mean that states will comply. And so we need to go beyond the language of thinking about human rights as charity and really strengthen them by creating wider obligations. My fifth and last point is around monitoring and accountability. So we need to ensure that human rights themselves have some teeth, that we have mechanisms through which we can ensure that countries comply. And if they don't comply, we need to ensure that something happens as a result, that there is some form of sanctions. But above all, in thinking about the human rights of the future, I think I want to leave the panel and the audience with this thought. Just as Tim provoked us, I think we need to really ask ourselves whether human rights in their current form are capable of challenging power. And this power might be different forms of power. So it might be the power of corporations, such as pharmaceutical companies. It might be the power of states that become really powerful in terms of crisis. We really need to ensure that human rights are fit for their purpose in challenging this power, but also in giving ordinary citizens agency to challenge human rights abuses, but also in terms of the process. So we need to ensure that as we are thinking about this process, we are widely thinking about involving populations in really rethinking what human rights meant to them in the current crisis and how they could be better for the next crisis. So I look forward to discussing with you and getting some questions from the audience. Thanks again to Ben and Jude and Tim who've spoken before me for really setting up the key issues.
So thank you, Sharifa, for pointing us in a way forward in these debates. Thank you to Jude and to Tim for setting off our conversation, helping us to understand some of the promise and the limitations of the IPPPR report. I hope now to turn it over to the Q&A and help to respond to some of the questions that you have in thinking through some of these issues. And in focusing on the Q&A, I'm going to stop screen sharing because apparently I can't see the Q&A when I'm screen sharing. In thinking about this, we begin with Daniel Kiwi, whose concern is around the limitations in the enforcement of international human rights law. It takes too long. And so how, and this is a question for all of the panelists, how do we think about new ways of advancing human rights in global health? Is this about strengthening WHO's capacities to think about human rights? Is it about creating a new body that's focused on human rights, or about using the existing human rights system? What kind of institutional mechanisms can we begin to think through in building up support for human rights in global health? And Jude, can I perhaps start with you in thinking about these institutional questions and thinking about some of the existing human rights institutions?
Thank you so much, Ben, and thank you for your excellent question, Daniel. I mean, there's probably a range of different ways you could answer this question, and you might find that all the panel have slightly different views about it. So I'm just going to present my views, and then Sharifa, Tim, Ben, you may agree or disagree with me. I will hand over to you. But okay, look, you know, I think it's very clear that this is a public health crisis and it's a human rights crisis. And yet we see human rights have been completely marginalized in the global response, which has been driven by the public health community. So let us just start, first of all, by looking to the human rights institutions that already exist. And I mentioned that these institutions provided a lot of guidance over the last year. But it's also the case that many of these institutions, the treaty bodies that you referred to in your question, they weren't able to fulfil their mandates in the way that they normally do. They weren't able to provide oversight of states' compliance with the treaties because of the restrictions of the pandemic. But they are now starting to meet again. There's certain procedures that take a long time, but and there's many ways you could criticize those bodies or the Universal Periodic Review, but they're what we have to work with at the moment. So in the immediate term, I suggest that we really try to engage these mechanisms and support their engagement with the WHO as well, and the broader UN system, and we hold states to account using these mechanisms. I should also add that it's been quite difficult to hold states to account at the domestic level in many countries during the pandemic, because as I mentioned, the governance structures that we tend to use, the oversight bodies that we tend to use to hold states to account where it's possible to do so, were also shut down. And many of them are still struggling to function. So, but we need to go back and we need to try and bolster and engage with those bodies. I'm just going to close with one further remark, which is one thing that I am really concerned about is whether human rights people are going to be at the table in negotiating these developments in global health law, whether it's to do with the revisions to the IHR or a pandemics treaty. And that's absolutely essential. It's essential that we have human rights experts, we have human rights agencies of the UN engaged as equal partners in these developments. And we have seen previous examples where we have had human rights experts engaged in what is otherwise sort of public health or development accountability and monitoring. And it's when the human rights experts are at the table as well, equally that human rights concerns are better promoted. So that would be my recommendations. But let me turn it over to my co-panelists to disagree or agree with me.
So should I go?
So
I think that there is something here about the framing of human rights and about ownership that I think has been missing from a lot of the work that goes on in public health. And I think actually, so although I agree with Jude that many countries struggle domestically, I was actually really emboldened by what happened in lots of countries in the global south around the framing of abuses as human rights and not, it wasn't anything. So when people went to court in Malawi, they were not saying the government should just not shut us down because of this law. They were saying we have a human right to food, or in Kenya. And some of these were not successful, but I think that something has changed there in terms of ownership of rights. That's really fundamental and important, and that we should hang on to in terms of people thinking of these rights as their rights and as something that we use in conversation with the global health community in order to demand them. And so to give people agency of these rights. And so for me, any attempt to make treaties has to take seriously the issue of the individual, both to demand rights by some mechanism, but also so that if their rights are violated, we need to have kind of multiple levels of looking at that rights violation. And some of them might be at the country level within constitutions. Some of them might be at the regional level, where we have some regional mechanisms as well that have been sometimes robust, sometimes not so much. And also at the international level. So I think that that's really essential in rethinking rights.
And I'll just close this off by recognizing that when we talk about human rights and global health, we're not just talking about the World Health Organization. We're talking about the range of international organizations, funding agencies, and international bureaucracies across the range of economic, social, and cultural fields that underlie public health in a globalizing world. And so WHO is possibly the leader of this space, but we need to think about the ways in which human rights is implemented across a proliferating, decentralized, and fragmented global health policy landscape, both in the global health agencies, from the World Health Organization to UNAIDS we mentioned earlier, to the International Labor Organization and UNESCO, to thinking about the human rights space and trying to understand how human rights governance systems, from the Office of the High Commissioner for Human Rights to the Human Rights Council, are considering public health issues. And so in thinking about the range of diverse agencies, and I apologize because it's holding up my computer right now, we developed a book a few years ago called Human Rights and Global Health, Rights-Based Governance in a Globalizing World, which currently serves to hold up my computer, but is otherwise helpful in understanding the range of different institutions across the global health space and the human rights space that all need to come together, understand their institutional responsibilities, and partner to make human rights a reality. Having cut off Tim in this conversation, I'll begin the next question with him because it's a question that he, Sharifa, and I have been thinking about throughout the morning. It comes from Marinilda Rivera, who asks what concrete actions are necessary to achieve vaccines as a common good. How do we think about the role of human rights in placing obligations on states, international organizations, the pharmaceutical industry, where those actions are taken that threaten the lives of individuals and that I would say undermine the human right to health, particularly around issues of patents. And so Tim, let me begin this question with you. And then Sharifa and Judah, I'll turn to you after that.
Yeah, so the question is really easy to answer on some level and then really difficult to answer on another. So the easy answer to that is that it's very obvious that there are some measures that can be taken. Firstly, the flexibility or the waiver on intellectual property rights, which has been mooted at the WTO, needs to be supported and expedited. And one thing which I can say that's positive about both the IHR review and the IPPR review panel is that there's agreement on that. And this is really what's being recommended, although these recommendations go to states more broadly, and the WHO has already supported this position. But that's not going to be enough. One of the problems is that we have a system which generally ensures that access to medicines in the world is very unequal and really, really, really expensive. And that's fundamentally about an understanding that it's okay to be able to profit off of healthcare. It's okay to be able to profit off of the production of medication. And that needs to be changed. I think that all of us as panelists would probably agree that this is inconsistent with human rights as they are. However, these systems are part of bigger economic systems and political systems which exist all around the world, and they're not easy to chip away against, because the pharmaceutical companies, for example, hold a lot of power. And part of the problem is that historically international human rights law has not busied itself sufficiently with holding corporate entities to account for the damages that they cause to human rights. And then there's a big move to try and prevent this and to reverse this, which again is being opposed by states, many of the states who are also opposing the TRIPS waiver vaccine. But the last thing that I want to emphasize is, other than all of these problems in global inequality, we shouldn't let our governments in the global south anywhere use as a complete justification for their failures to provide us with information about vaccines, the terrible conduct of countries in the global north and pharmaceutical companies. In many countries, including my own here in South Africa, there's much, much more that we could have and should have done had we paid more attention to the human rights of people to access to vaccines. And even within our countries, if we're honest about it, what we will also be seeing is inequality like we're seeing on a global scale within our countries in access to vaccines and all of the attendant problems. Somewhere along the line, human rights do provide a very good guide for how these processes should have happened. And inadequate attention has been paid on national, international, and regional levels, which has caused the situation that we're in, which is really a travesty.
Sharifa, let me turn to you, but also add to that a question that was specifically directed to you about vaccines from Smita Pakale, with apologies if I've mispronounced that, to think about how we give power and agency in this question of vaccine to ordinary people while balancing rights-based issues of personal freedom that we've seen. How do we balance the right to access vaccines with the rights of anti-maskers and anti-vaxxers?
Yeah, that's a fantastic question. So I think there are two things. So firstly, I wanted to say something about this idea of vaccines in terms of access. And one of the things that I think that we have missed on is that even in developed countries, in countries of the so-called global north, I think that if your government has pre-purchased vaccines and therefore has overpaid, I think you should be asking yourself, what else am I not going to get as a result of that? So if you're thinking about health as a collective good, if your country spends all its money trying to purchase vaccines so that another country doesn't have them, that will have an impact on cancer care. It will have an impact on primary health care. And therefore, that is a human rights issue for you. And I think it really chimes in with Smita's question. We really must think of health not as an individual entitlement, but as something that is a collective right for society. So it's not just about you, the individual. And therefore, these ideas of proportionality and what that means, especially in terms of a crisis, becomes really important. And I think that the work there that the ICJ is trying to do with the Global Health Consortium is going to be really fruitful in helping us to think about what that balance is, especially in light of a crisis. How should we think about that collective right, and where should the balance be?
As we think through institutional ways of balancing health and human rights, bringing together global health law and human rights law, and making human rights a reality, I want to turn to Jude with a question that we have from Kyle Knight, who's thinking about the different mechanisms and institutions that are being proposed to advance global health and advance human rights. And the concern that if there are too many institutions, that states may, Kyle uses the term forum shop, that states may seek out a different institution that is more favorable to their own ends. He says, we already know compliance with the UPR, the Universal Periodic Review, isn't stellar. Will creating a new UPR-like mechanism for health just dilute human rights and global health? Is there an argument for strengthening existing institutions rather than creating new and parallel ones. Jude, can I start with you on that question?
Yeah, thank you very much. And the parallel that I'm thinking of really is about the Sustainable Development Goals, where there are different accountability procedures, and they've all got some strengths and they've all got some limitations. And that's, I'm thinking about procedures across international development and those within the field of international human rights as well. So if you look at the SDGs, they are routinely raised by treaty bodies, by special procedures, and by the Universal Periodic Review. And the way that it's often conceptualized in the SDG, in relation to the SDGs, is as a web of accountability. So what's really important is that whatever mechanisms are developed, the importance is to ensure that they link into one another, and ultimately that all of them, all the recommendations are made with a sort of human rights lens in some way or another, with some bodies perhaps providing more specific guidance than others. But they all are human rights consistent, and that they all feed in to national review processes and planning and lawmaking at the domestic level. And I think that whatever happens in this field, we also need to think of that notion of a web. You know, building in human rights across a number of institutions and mechanisms.
Sharifa?
So yeah, so I share the anxieties around fragmentation and the danger that we have that we just increase the number of bodies, and we don't necessarily make human rights stronger in any of these bodies. And I think we have to be alert to the process as people who are activists around what's happening. We have to speak out and kind of sustain speaking out. But I think that we also must involve publics, and whichever publics that we are thinking of, around kind of the very essentiality of these rights. So many of these institutions have already, many of these countries have already signed international agreements around rights, and they should not be allowed to sign international treaties that really do not take human rights into account when dealing with public health. And I think that that is quite critical.
And I would only add to that, that what we need to think about as we begin to think about these institutions to ensure that they're not parallel institutions is making sure that partnerships are developed from the very start. Whether it's a framework of understanding or memorandum of understanding, a framework of cooperation, these cooperative agreements can ensure that there's representation of different institutions in other institutions. I can't control what states are going to do in creating new parallel or possibly superfluous institutions, but I think we can work together as advocates to make sure that where they are created, that there are agreements in place to ensure that they're able to work cooperatively rather than redundantly. Let me now turn, as we near the end, to Robert Mwanguzi's question. And Tim, he's concerned about this question of enforcement of human rights standards in pandemics using sanctions. To what extent can we think about the role of sanctions, particularly in the global South, he asks, thinking about the capacity challenges that countries face in ensuring human rights and global health?
I mean, the question of sanctions is always an interesting one and a fraught one, because in many circumstances, the question is, what effect do the sanctions have and how do they help? And then the second question in this circumstance is, who are the sanctions against? Right now, when it comes to vaccine access, for example, the sanctions that we would have to propose would be against countries that are housing big pharmaceutical manufacturers that are violating human rights. And those are countries that are not very easy to put sanctions on. The US, China, India, Russia, those types of countries. As far as the question is more generally, I think that the problem is that what we really need in the context of a pandemic is coordination and cooperation. And sanctions is like really something which moves in the opposite direction. So I would say that, you know, both strategically, practically, and ethically, there's concerns that I would have about that. And if I could just, I'll just say one thing quickly about the previous question. The thing that bothers me about the forum shopping thing is not necessarily that per se, because that happens as a matter of course. The real problem with it is that the answer when something fails, it seems to be always, is to create something else. And one of the problems that we've all been trying to highlight is that, number one, even if we just used existing international legal standards in human rights or in the IHR, and states took them seriously, we'd be in a much better position than we are now. And number two, the proper and best interpretations of international human rights can get us very far to a much, much better system. And so the question is, are there attempts to create new things, attempts to genuinely improve the processes, or are there attempts to forestall and satisfy the criticisms that are happening? And as human rights activists, I think that we need to think very clearly about this before we support these new ventures and how we support them and to what degree.
Sharifa, Jude, final thoughts? Sharifa?
So I think my final thought in some ways is that we kind of shouldn't despair. So I know that as human rights lawyers, activists, people who care about them, we spend so long thinking about their violation. But we can also think about how far we have come. So if you think about this whole TRIPS plus, the TRIPS waiver, it's still disappointing that 20 years from now, we're still having the same argument, but actually the argument has shifted. We're not having the same, it's shifted in a way that kind of says, let's think about our partners in the Global South, let's think about collective rights. And so I think let's be optimistic, but also let's kind of be alert as to the possibilities of human rights in helping us to kind of make these fundamental changes, because we've seen that human rights are so important. And I think that we can use them to make differences.
And so we recognize that action is needed to strengthen human rights realization throughout global health governance, in the World Health Organization, but beyond, whether it's the World Trade Organization, the Security Council, the human rights system, and the Universal Periodic Review. This unprecedented pandemic really raises an imperative to reaffirm our universal commitment to human rights, to think about the world that we want to build coming out of this moment, with human rights providing a framework to prevent, detect, treat, and respond to infectious disease threats. From the work this week in the World Health Assembly, the World Health Organization has an opportunity to strengthen its human rights policies, programs, and practices, providing a role for human rights and bringing the world together in solidarity to realize the highest attainable standard of health. Please join me in thanking our panelists, Caitlin Williams, a doctoral student at UNC who's been on the back end, making sure that everything has worked smoothly throughout today. And thank you for thinking about how we can make this vision of human rights and global health a reality in this World Health Assembly and in the years beyond. Thank you so much. Be safe, and I hope to see you in person soon.